Good afternoon, everyone. On this afternoon's briefing, we'll first hear from Mayor Tom Barret. Then we'll hear from County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, Ann Christensen, the Health Director and Health Officer for North Shore Health Department, and our guest today is Dr. Jacob Bidwell, Designated Institutional Official and Vice President for the Academic Affairs Department for Advocate Aurora Health Wisconsin, and President of Aurora University of Wisconsin Medical Group. Thank you all for joining us today. And Mayor Barret, I know your time is limited, so we'll start with you.
Thank you very much, Catherine, and I apologize ahead of time. I'm going to be sneaking out for a meeting having to do with security for the Democratic National Convention right after I speak, but I did want to be here today. We're basically reaching a milestone today with the two community centers, the two community testing locations, on the north side and the south side. We will have tested our 50,000th test today. We're at 49,910 going into today, and so I'm very confident that we've had at least 90 for the day. And the reason I'm so confident is yesterday we had over 1,200 at the UMOS location on the south side and almost 600 at the Custer Obama location on the north side. So when you're seeing numbers like that of about 1,700 a day, 1,800 a day, it means that we are really seeing a lot of people getting tested, which is exactly what we want to see. We want people, if they're feeling sick in any fashion whatsoever, if they feel they have the symptoms, we want them to get tested. Even those who are asymptomatic, again, are free to get the testing that's available at these two sites. Or you can call 211. That's where you can go and get a number of the different locations that we have throughout the city and throughout the county where you can be tested. That is something that is very, very important for all of us as we try to do everything we can to contain the spread of COVID-19. I also want to touch on what has been in the news a lot locally and nationally, and that is the whole issue of masks, wearing face masks. We continue to move forward here at the city, although an important step is going to be the Common Council. It is going to be before the Common Council at 2:30, I think, tomorrow. They'll have a meeting where they will take this up. And then on Monday, there's a chance that they may be in as a full council. That's still to be determined. But the committee meeting is going to move forward, and they're going to have a committee meeting on this. Just to give you a glimpse of what's in the legislation right now, it would require individuals to wear masks while they're on the inside of business establishments, whether you're talking retail or restaurant businesses, and on the outside, if you're coming within 6 feet of an individual. The enforcement would primarily be through our health department, and that means that for businesses in particular, if your individuals who are in your businesses are not complying, you are going to be responsible to make sure that they do comply. So we want to make sure that this is an educational effort. That's what we've been saying all along. It's not a heavy-handed effort, if you will, but all the evidence, and I mean all the evidence that we have seen, has pointed to the fact that this is something that's very, very important for people's health. And we want to make sure that people are doing everything they can to keep themselves healthy at this time. So we're pleased with the progress we're making there. We know that there's more work that needs to be done. But again, we're seeing that legislation moving forward, and that's something important to us. I also want to touch on cooling centers. When I saw the temperature just in the last half hour, it was still in the high 80s. At North Division High School, we will have our cooling center open through Friday, July 10th, from 1 o'clock to 6 o'clock p.m. Again, we want to make sure that people have that opportunity, but we also want people to be very, very safe. So make sure you're doing your social distancing if you're going to be taking advantage of that cooling center at North Division High School. So again, from the testing where we are seeing very, very strong numbers to the progress we're making on masks to finally trying to make people cool. We're trying to help as many people as we can through this very difficult time. And we appreciate the support and cooperation of all the citizens that have been involved in this. And with that, I'm going to turn it over to County Executive David Crowley. County Executive.
Thank you so much, Mayor Barret. Appreciate your leadership and just the efforts that you all have provided with opening cooling centers to provide residents refuge from the heat. Just like you said, with the temperatures being as high as they are, heat-related illnesses are a major concern. So it's important that people have air-conditioned place to go with food and water. So we want to thank the City of Milwaukee Health Department for ensuring this resource being available. I also want to echo Mayor Barrett's point about the increase in testing when we think about the increase we've seen following the holiday weekend. We know that many people got together with friends and family, and so we want to make sure it's a habit to get tested frequently, especially when you've been outside around different people that is not outside your household, or if you've just been in public places in general. I also want to say, give a special thank you to the National Guard who is weathering the heat to make sure that these tests are accessible to Milwaukee County residents. And also want to thank our healthcare providers who are providing tests throughout our community. And when you get tested, please be prepared to answer a call from your local health department. They'll call you either way, whether you're negative or positive. And it's extremely important that you speak with the public health officer so they can do their jobs in keeping our community safe. If you test positive, it's not anything to be ashamed of. And please don't go without information of who you've been with. We need to make sure that our public health officers are asking questions so they can help with contact tracing. They want to keep your friends, your family, and everyone in this community healthy, but the only way to do that is with the information that you provide. And I can tell you that later on we'll hear from Dr. Bidwell, who can elaborate on the importance of testing and the various misconceptions that may still exist. The mayor and I also want to continue to talk about the value of testing because it is critical, again, to minimize the spread of COVID-19. We've seen a lot of questions recently about, the city and the county masking mandates and, what orders are we going to be put in place at the county level. And I know it's confusing, but Milwaukee County, again, we do not have a health department. And so unlike Dane County that has a combined health department with Madison, Milwaukee County's health departments are broken down between the city and the suburban municipalities. We have 11 across all of Milwaukee County within all 19 municipalities. And so they all can make their own separate decisions. However, several weeks ago, Milwaukee County did announce that we would mandate people wearing masks in all Milwaukee County facilities. And we're still doing that because the data shows that there's a benefit from wearing a mask and how it can mitigate the spread of COVID-19. I also like to talk about a quick update. So today I had the opportunity to talk to the Milwaukee County Behavioral Health Division. And I joined them to really talk about the need to put more funding towards mental health services. And Milwaukee County's vision is to be the healthiest county, and the way to do that is by achieving racial equity. Our vision is more crucial now than it has ever been because we are facing two public health emergencies: the acute emergency of COVID-19, and the one that is deeply rooted in systematic and structural racism. And so when you think about our health, when it comes down to Milwaukee, we rank 71 out of 72 counties, and we didn't get here overnight. And if we're going to talk about solutions, they will have to be long-term. And so when we think about COVID-19, as you are very well aware of, we've seen a disparate impact on communities of color. And so we recognize here in Milwaukee County that structural racism has long contributed to the health that we see in our communities today. And so when we think about our Behavioral Health Division, otherwise known as BHD, they have made tremendous progress over the past several years to expand its provider network to focus on diversity and cultural competency, improving RFP and contracting practices, and enhancing racial equity training, and making sure that we dedicate more resources to workforce development initiatives. But this isn't enough, and we need the community support to create further change. And here's how you can help. We need people to continue to call their legislators. We need that direct and flexible funding for Milwaukee County, and we need that funding to stay strong and to continue to provide many of the critical services that we provide, like mental health. And I'd like to at least end on a positive note. So I'm happy to announce that Milwaukee County will be allocating $1.6 million of our CARES Act funding to the Behavioral Health Division to help with mental health and wellness support. And with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. So first, as always, to our numbers, we've had 13,096 cases of COVID-19 in our community and 358 individuals who've died. We've updated our Milwaukee County dashboard and changed a bit the way that we view and display data on testing. So whereas previously we had a lag in the data and a few days that were artificially inflated due to that lag, we've worked with the state to now have the data more true up to date. So to show more true testing numbers, more true percent positives. Additionally, we're now including all tests obtained as opposed to individual tests I think this should better help us to understand testing volume and capacity. So you can take a look at the testing tab and see that. Over the last couple of days, I've received some questions through emails and in person. I want to take a moment to answer 3 of those. One was received from a friend, one from a colleague, and one from a member of the community through email. I think if these 3 folks have these questions, probably a lot of others do as well. So a friend asked me about transmission rates. There's been articles and websites showing that Wisconsin has some of the highest transmission rates of COVID-19, often represented by the reproductive number. This is when compared to other states. So what does that mean about our state and the direction that we're going? The reproductive number represents how many people a single individual in theory infects. So if the reproductive number is 1, that one person passes COVID-19 to one other person. A higher number means more transmission, more cases. While the reproductive number does have some limitations, such as being influenced by testing rates, we're also seeing concerning trends in our state, such as increasing rates of the percentage of tests coming back positive. Regardless of which number you're looking at, the trends that we see nationally and in our state are alarming. We're not moving in the right direction. We must be proactive in our approach, both as a community, but as well as individuals. We can't make the same mistake that we've seen in other states where we wait to pull back on gatherings and to wear masks until our numbers get higher and worse. Next, I received an email from a gentleman in the community who asked why we're making such a fuss over case numbers when we're not seeing our hospitals getting overwhelmed and we're not seeing an increase in deaths. I think it's an understandable question and one that I hear a lot. There's 2 challenges with using hospitalizations and deaths to understand what's going on with the pandemic. The first challenge is that it's what we consider a lagging indicator. So from the time of symptom onset and the beginning of being contagious, it may take weeks for hospitalization and possible death. The second challenge is that we're seeing a much younger population being affected by COVID-19. From an average age of 52 years old in March to 36 in June and down to 34 so far into July. We know that younger people are less likely to be hospitalized and less likely to die. But we also know that they don't live in isolation, and transmission from younger to more at-risk populations will eventually lead to a rise in those numbers as well. This goes once again to the fact that we must not stand by while we see case counts and percent positivity rise, waiting for further proof of worsening in hospitalizations and deaths. Lastly, I had a question from a colleague that was simply, how does this ever end? Will we be wearing masks and physical distancing forever? It's a hard question that no one, despite what they may tell you, can provide a perfect and accurate answer for. Most experts agree that the most likely way for the pandemic to end is through a vaccine. There are 2 other possibilities. One is natural herd immunity, and the other is a gradual decrease in virulence or the harmfulness of the virus. On the latter, there's no great evidence or really reason to think that the virulence or harmfulness of the virus would decrease for any reason. As for natural herd immunity, that is letting enough people get infected and immune that the virus stops spreading, this would be a long road to go down, keeping in mind that so far, months into the pandemic, we're maybe 5% up to perhaps 15% of people in some areas that have been infected. That said, a vaccine is the best and most realistically hopeful way to see an end to the pandemic. We've seen promising initial development, but a viable vaccine is still likely many months or more away. Questions remain as to how effective a vaccine would be, how it would be administered, how much could be manufactured, and if it would have to be repeated regularly, and even whether people would be willing to get it in large enough numbers to hit 70% plus immunity needed to significantly slow the spread. That's all to say that we are very likely a ways from the end of the pandemic. But there is indeed an end. Life will return to normal, but in the meantime, we must do everything we can to continue to slow the spread and keep our community healthy. Most important at this point is limiting, or better yet, eliminating close contact with those outside your household, wearing a face mask in public, and getting tested for COVID-19 if you have symptoms by calling 211. Thank you and stay safe, and I will hand it off to North Shore Health Department Director Christensen.
Thanks, Dr. Weston. My name is Ann Christensen. I'm the director of the North Shore Health Department, which serves the communities from Shorewood up to Brown Deer. I'm standing in for Darren Rausch, who is the Greenfield Health Officer and normally gives the epidemiological report. I'm going to give an abbreviated version of the report. You can access the report online at the Greenfield Health Department's website if you'd like to see the full report, and Catherine can send it out as well. But I do want to highlight some of the key components of it. So Catherine, if you could share the first slide, that would be helpful for the group. Excellent, thank you. So as you've seen and become familiar with this graph or this figure, essentially it represents the number of cases both broken out by the city of Milwaukee and the suburban communities. And the important things to see in this is that we're seeing increases in the total cases within Milwaukee County over the last week or so. And that's indicated by the tail end of this graph. That's the story that comes along with increased testing, but it's also the story that comes along with increased transmission in the community. And I'll talk more about that in just a minute. Essentially, the yellow line reflects that 7-day smoothed or rolling average, and the blue line is the suburban communities. And then, as I mentioned, we're seeing a significant increase in that number, in that trend line for the last week or so. And that really translates for us in public health as 75 to 100 new cases each day that we're responding to. And as County Executive Crawley said, there are 11 health departments. So really the work burden on the health departments is certainly increasing with those daily case counts being so high. You can see that there's ebb and flow in any given day, but again, the trend is certainly continuing. Catherine, if you could show us figure 2. This represents a different perspective in the story in terms of the number of deaths by day. So this, again, the overall case counts for deaths as well as the trends. And this terms of the story is somewhat of a good news side of this story in that the death numbers continue to trend downward for both the suburban communities and the city of Milwaukee. So that is certainly a good thing, and wanting to recognize our healthcare providers for providing such excellent care for our patients that we're really been able to ward off a lot of the fatalities that we had seen much earlier in the pandemic. Catherine, I'm ready for the next slide then. So talking a little bit, and this is super small, I apologize for that, but I do want to share some of the demographic data with you because this kind of provides a little bit more of the nuance of the story. One more specifically is age breakdown. I think Catherine's trying to enlarge it for us, but the ages and where we're seeing the trends is really important to note. And that's our top graph here. So our incidence rates for the highest age group is the 80 plus, and that is still the highest group where we're seeing cases. But what you should note, and what's important to note, is that the increase in the numbers of people 18 to 39 is certainly increasing. And in terms of the overall number of cases, since early May, this group has been the one that we're seeing the most cases in. And certainly concerning and reflective of trends that we're seeing in local health departments with regard to our contact tracing. So this is also happening across the state of Wisconsin as well as the country overall. And this is reflective in a lot of that social activity that we're starting to see, as well as work sites and people getting back to work in an office environment and starting to experience transmission in those settings. It's a group we're monitoring, and I think Dr. Weston pointed out really well about what's the impact of this. And while certainly those groups may not be impacting our healthcare systems in terms of hospitalizations and deaths to the degree that older adults are, they certainly do have family circles and they have other contacts in the community. And so we are very much concerned about that transmission to those more high risk, more vulnerable older adults. So this is a group that we're watching and again, continuing trying to reach in terms of the messages about social distancing, hand washing, and staying out of large gatherings and large social circles. We've reported, moving on to the race and ethnicity data. I think this has been a story that is certainly important to continue to share. That's still on that slide there, Catherine. Still important to continue to share. Looking at that green bar, the Hispanic population is continuing to be one where we're very concerned about, in terms of that they are more than 2.5 or 2.3 times greater than the next group, which is the African American and Asian populations. So again, certainly concerning, and a group that we're continuing in public health to try and reach with both prevention messages, as well as for our contact tracing to contain the spread in those communities. The gender information is, again, the same story in terms of increasing numbers, and not a whole lot of differences with regard to male and female. So if you go to the, you can just go back to me then. So again, that's a very abbreviated version of our numbers. What is happening underneath the numbers, I think, is also helpful for people to understand, in that we're concerned about transmission, and we're concerned about those increasing cases. Where we're seeing it show up is our contact tracing. As County Executive Crowley mentioned, public health is responsible for identifying those who've been exposed to cases and following up with those, to both alert them, but also to recommend for that quarantine period. I have 2 points to note on that. One is that those numbers of close contacts have grown, certainly over the past month to 6 weeks, when Safer at Home has gone away. An indication that people are much more out and about in the community and having more of those contacts. So that's one thing to note. And then what we've been observing is the types of contacts that people have had. Again, we continue to see those contacts at workplaces and work settings, but we're also seeing the contacts in people who've gone to social gatherings, family reunions, traveled out of state. Understandable that it's summer and people want to get out, but again, the risk of transmission in those settings is high, and we want people to be very thoughtful about when they go out and who they're exposing or potentially exposing themselves in those situations. So remembering that, making sure that people are safe and practicing social distancing when they are in those settings. It is possible to have a family reunion or a family setting where you're socially distant, you're not sharing food, you're not sharing utensils. It looks a little bit different, it feels a little bit different, but it is a way to stay safe and still continue to have those opportunities together. So that's an important message in terms of understanding the close contacts. So thank you. That is I do want to share back to Mayor Barrett's point about the masks. Shorewood also has recently, as of last night, passed their own ordinance in that municipality to have a requirement for people to be wearing cloth face coverings in indoor public settings. So they are publishing that information today for the general public to be aware of. But again, similar to the City of Milwaukee's ordinance, that those masks would be required in retail and restaurants and other indoor establishments that are open to the public. The enforcement arm of that is still focused on education and wanting people to know that this is really a serious matter, and that people really should be wearing masks for the prevention of COVID. There's the focus for the enforcement is really the one education at this point. So thank you. That's the public health update, and appreciate the chance to be with you again.
Thank you, Anne. And now we'll hear from Dr. Jacob Bidwell.
Thanks, everybody. Just wanted to go through a few key points here. One is the goals for testing. And with the goals for testing, we're hoping, and our overall state's goal is to complete more than 185,000 tests per week, especially for high-risk populations. So the minimum goal for daily testing in Milwaukee, in the county, is 2,000 tests per day. And so wanted to make sure that we're achieving that, and to get the word out that, again, everyone's been reiterating this throughout this call, but if you have any symptoms, if you are involved in any close contact situations with anybody, if you're contacted by one of your local municipalities, health departments, please go get tested. And if you don't know exactly where to go, again, that's the 211 number is available for everybody to call. And just really important to get tested to know if you are positive, and then you can prevent the spread to others. And also you can also know for your own health if you are negative. I will say though that the test is only good for that particular day, and the timing of the testing is also very important. So when and if you are contacted to go get tested, please follow the instructions of your local health departments or your own physician, if you're recommended by your own physician or nurse practitioner to go get tested, because the timing of the testing in relation to when you might have been in close contact with a positive case would be very important. The other key piece that I get a lot of questions about are the differences between the different diagnostic tests. At this point, the vast majority of the diagnostic tests that we're using at all of our community testing sites, as well as within our local health departments, is their nasal swabs or nasal pharyngeal swabs. And that just relates to, and you guys have probably all seen videos of this on television, on the internet, Facebook, or Twitter. But the difference is the depth into the nasal cavity that the swab needs to go. Most of the tests now are very accurate regardless of the location, but it does need to be done properly. Well, early on in the pandemic, we felt, based on a lot of the studies at that time, that the viral load, or the amount of virus, the particles of virus, were highest in the very deep part of the nasopharyngeal cavity, so the deeper part of your nose. As more data has become available and the science has progressed, we found that the anterior part, the less deep part of the nose, so just the outside of the nose, has enough virus particles to be picked up. That, combined with the science of the testing, has been able to pick up COVID in pretty much all of these tests, and they're all very reliable. The main difference between the rapid type tests and the tests take a little bit longer is really depending on, at this point, on the urgency of the case. So if you would come in through an emergency department because you are very symptomatic, or because you are in a situation where you could spread it to others, for instance, coming in for a test or procedure like a colonoscopy for preventive measures, or for other procedures because you have a high-risk condition and you need ongoing monitoring. Most of the healthcare facilities in the nation, certainly all of the ones in Milwaukee County, are now requiring you to be tested, usually the day before or 2 days prior to you coming in for that scheduled test or procedure. So we can turn around those tests within a day or two if you're going to be hospitalized or need a test or procedure. The difference between that is just the urgency of the situation. Most of the community testing sites will turn those tests around anywhere between 2 and 7 days. And that really depends on the total number of tests being done and how quickly the lab workers are able to turn those tests around. Obviously, we like to get that down to an immediate, 5-minute type test. Right now, the technology is not generally available to do those tests with that rapid of turnaround. Unfortunately, most people don't need that rapid of turnaround. But again, we have plenty of testing sites and plenty of testing capacity available to test everyone at this point who would need a test. So again, I think everyone's been reiterating this throughout the entire call. If you feel you need a test, please call. Please make sure that you're reaching out so that we can get you accurate advice on whether or not to get tested and where to go for testing. The other types of things that I would say, I think some of the myths or misconceptions about getting the test itself is, number one, it doesn't mean that you weren't infected. It only is good for that particular day and time that you got the test, and the virus particles were not present where they tested. And again, that speaks to what I mentioned before about the timing of getting your test. So make sure that if you get a test early and you are negative, but you continue to have symptoms, or if your symptoms worsen, please call again, and that might be a role for repeated testing. The other potential role for repeated testing is in situations where you potentially have an ongoing exposure, either through a work setting, as Ann mentioned, or through like a healthcare setting where you were in a healthcare facility and potentially needed repeat testing following a positive test after that to make sure that you had cleared the virus. So there might be a few different situations for repeat testing. But again, there I would follow the advice of your public health department once they reach out and give you guidance. And then also, don't forget to make sure that your primary care physician or primary care nurse practitioner and your clinic, if you have access to a primary care physician or primary care nurse practitioner, that they're aware as well, so they can help guide your follow-up for that infection. Since there are some standard lengths of time where we would want to make sure to follow you to make sure that you're gradually resolving your symptoms and feeling better, so that you can get back to normal as quickly as possible. I think this was mentioned, but the other piece to this is how you're going to be notified. It's really the responsibility of your local health department in the local municipality where you live to contact you regarding the tests. But I know that a lot of the healthcare organizations will also contact you if you were tested within the context of that organization, specifically if you had symptoms or if you were coming in for a diagnostic test or procedure and needed to be tested ahead of time. You would be notified of that positive or negative test. And as was mentioned before, we notify everybody of the test results, whether they are positive or negative. So if you are not receiving a call back, please do not assume that your test was negative. Please make sure that you call the facility that tested you if you're not contacted, and make sure that you are aware if your test was positive or negative. I think we've been very good about following through and closing the loop on all test results. But again, I just want to make sure that everyone is advocating for themselves as well, and don't assume that your test is negative unless you've been told it was negative by the testing facility or your public health official. Okay, the other one, this comes up with my patients quite a bit on whether or not testing and the test itself is particularly painful or uncomfortable. I've had these types of tests done myself, not specifically for COVID, but for other reasons for my own health in the past. And I would consider them uncomfortable but not painful. It would be very similar to the tickle that you get in the back of your throat or the uncomfortable feeling that you have sometimes right after a sneeze or a cough, where there's something sort of in the back of your throat or in the back of your nose. It's very similar to that. It's uncomfortable, and the posterior aspect of your nose does have sensation. It's very brief, and it's for a very good reason. If they need to do that type of swab for the particular test that you're getting. The vast majority, though, again, now we've moved to the anterior part of your nose, the front part of your nose. So it's really more like a Q-tip in the front part of your nose. So it's very mildly uncomfortable, but really we're working very hard to try to make sure that everybody is as comfortable as possible during the procedure. And prior to testing, you'll be educated on exactly what to expect when you go to a testing site. So from the early days of this, when I think it was quite scary to go get a test and people were quite fearful, we've advanced quite a bit in a very short period of time. So at this point, our overall goal in Milwaukee County and all the other counties around the state that we've interacted with over time, as well as all of the other healthcare systems, our number one goal is your safety and your comfort during these procedures and during any time that you would interact with any of our testing sites, and the safety of our testing team members as well. Because we want to make sure that they're protected, that you're protected, and everyone in the community is as safe as possible. So those are just some of the different pieces that I often will get questions on. I know Ben and Ann also mentioned a few different things there too. So with that, I'll turn it back over and see if there are additional questions.
Thank you, Dr. Bidwell. That's really helpful context and helpful to debunk some of those myths that we might hear. So we will move into the Q&A portion of the briefing. And our first question comes from Brett Lemoyne with Fox 6. And it is perhaps for any of our healthcare professionals, and maybe we'll start with you, Dr. Weston. He asks, what percentage of Milwaukee County COVID tests are people who have been tested multiple times?
Yeah, that's a great question. So that's one of the changes that we've put on our dashboard. It is a relatively small percent. We know how many individuals have been tested, and that number is around 132,000. And then we know how many total tests we've had, which is 168,000. So that doesn't mean that 30,000 more people have been tested multiple times. It means 30,000 tests have been done on people multiple times. We don't have the exact number of how many individuals are getting multiple tests, but it seems to be a relatively small number in the scheme of altogether testing.
Okay, excellent. Our next question is from Mark Stevens with CBS 58, and it's directed to you. Have any health departments in Milwaukee County gotten the same type of harassment like their counterparts in Ozaukee or Washington County?
Yeah, we were really saddened to hear what our other colleagues are experiencing in Washington, Ozaukee. In taking the pulse of health departments, I feel like, we've certainly heard and been on the other side of people's frustrations in terms of the whole process of COVID, whether it's the safer at home order or having to be the one to share the message that you've been identified as a contact or a case. So there's certainly been frustrations, and we work with people where they are and try to get them to a place of understanding of what public health is and what our measures are. We certainly recognize that there's a broad spectrum of response to certainly those mitigation measures that that have been put in place, as well as considered even in the future, and that they all have different impacts on people's lives and livelihoods as well. So we're very recognizing that we serve the public and that there's a lot of different emotions and feelings going on out there. I would say more generally, though, this is a really challenging time for public health, and we've been doing this full 24/7 for a while. And so more generally, I think the public health professionals really deserve a lot of recognition and support right now for the great work that they're doing. And that's what we really need, is that support from the community. And as County Executive Crowley mentioned, that support doesn't need to be flowers. It's appreciated, but really it's just recognizing that when the phone rings from public health, we're trying to get some information and help you with your disease if you do have COVID, but also your friends and neighbors who you might have exposed. So really recognizing that, that's our job, and we're trying to do it in the least intrusive way as possible on your life. As well as your own families. So please just to try to work with us, and that would really go a long way in demonstrating that support for public health.
Thank you, Anne. Our next question is from Courtney Garish with Spectrum News. It's twofold. The first is for Dr. Weston. The next is for Dr. Christensen, or Director Christensen. The first question for Dr. Weston is, what is the transmission rate for the county and state? And for Director Christensen, you mentioned social gatherings being one of the key transmission settings. Does that include any protests?
Sure. So the transmission rate for the state has been about 1.27, and for the county has been 1.2. I guess, again, like I talked about before, I think that transmission rate is easy to understand and has some value. I would say percent positive, especially as testing rates are fluctuating, is a number to focus on a little bit more. Milwaukee County has been 5.7 for our percent positive, or I'm sorry, 8%, and the state is 5.7. So Milwaukee County, 8% of tests done result in a positive finding, and in 5.7% of tests result in a positive. So that's a number to watch really on a daily basis to understand what sort of trends are going on in our community and in our state.
Yeah, and maybe back to your question about where those where that transmission is occurring. In terms of the protests, again, it's very challenging for us to identify that one point where somebody may have picked up the virus, especially for people who have indicated that they've been, really isolated from the public or out in workplace settings or just going to the grocery store. So even in a protest, it's hard to go back and say this is the moment where you picked up the virus. But I think it's more focusing on risk of transmission and what those settings are where you're most likely to get the virus. And certainly we know that an indoor environment is going to be a place where there's going to be higher likelihood of transmission, where we're in a space with people for a long duration of time and in close proximity. So again, those places where if people are gathering in one's home and they're all crowded around the kitchen like we like to do around Thanksgiving and other social events, that's going to be a place where there's going to be more likeliness of transmission. Outdoor settings is certainly possible. That is certainly still a risk, but we've seen from the science that the risk of transmission in those outdoor environments is lessened because of that increased airflow. And certainly as people in a protest or in a rally are moving through space, that's going to be, again, a place where there's going to be less likely transmission compared to some of these other settings. Again, those indoor environments are certainly places that we're seeing people having been exposed.
And Dr. Bidwell, I don't want to exclude you. I don't know if you have any additional context you wanted to include as far as transmission rates or just contact tracing beyond our two experts' advice.
No, I think they did an excellent job. I think that the one piece is, as I drive back and forth to work or, just go back and forth to do various things like getting groceries, I do see a variety of different activities being done, whether it's in outdoor parks or, just walking down the sidewalk and those kind of things. And I think Ann mentioned it very well along with Dr. Weston. The three main things are still going to be wearing a mask over your mouth and nose. It's got to be both. See a lot of different styles there, but it's got to be both. And distance and hand washing, and then vigilance on top of that. So any situations where you're not seeing that is a risk of possible spread. And as Ann mentioned, there's going to be varying levels of risk depending on the activity and depending on the location. So again, the absolute safest is, more than 6 feet apart with a mask on and making sure that you're sanitizing and hand washing. So that's the only thing I would add to what they said. But I would say there's varying levels in any activity. What we're trying to do is minimize risk as much as possible.
Thank you. Our next question is from Shepherd Express, and perhaps Director Christensen, we'll start with you, and then Dr. Weston and Dr. Bidwell, you can jump in afterwards. So they're asking, given the coming school year, have there been any trends from contact tracing among either summer school attendees or daycare facilities?
Yeah, that's am I muted? No, okay. I think that's a great question. In terms of trends, we really look at kind of a longer term horizon for that, but we are definitely seeing anecdotal evidence of more transmission in school-age children or more disease cases amongst school-age children. It's children that have involved in sporting activities, seeing just anecdotally a number of cases in those groups. We are also seeing a few more daycare facilities that have positive cases as well. So that transmission is certainly happening in those circles, again, as a result of just increased activity and places where children and adults are coming together.
Anything else to add, Dr. Weston or Dr. Bidwell?
No, I don't think so.
Nope.
Awesome. All right, we'll move to our next question, which is from Nick Williams with the Milwaukee Business Journal. And Director Christensen, he's asking, 4 of the county's 5 key indicators are yellow. Is this viewed as a positive trend, and should people expect more restrictions to be lifted in the coming days or weeks?
I see it as a cautious sign. sign, but as we've been talking and reporting today, that caution is measured. And so while the indicators are still showing promising signs, it is my understanding of the case flipping from red to yellow is that it's still really hovering close to red. And so we want to continue to be vigilant about all of the measures we talked about today. I have not heard, in terms of the county, Milwaukee County suburban communities, I think, again, there's a lot of restrictions that have already been lifted. And I think that we feel comfortable staying with this gathering limit recommendation of 50 people, as well as the occupancy limits for restaurants and retail establishments. And the reason for that is, again, we want to keep the pressure on ourselves to make sure that we're able to avoid some of the spikes and increases that you're seeing in the other states. And as I tell people in our health department in our region, our goal is really to get to a place where we can have schools, back to from Shepherd Express, schools opening in the fall. So the more we can do now to prevent ourselves from increasing and seeing more spikes, the better off we're going to be in September. And so I think those measures are still really important, as well as the ones that people can do as individuals to protect themselves, which would be the face coverings, good hand hygiene, et cetera. So if we can all do these measures and keep some of those restrictions in place, again, the goal being focusing on fall and getting children back to school and back to normalcy.
Yeah, I would just add to that. So part of the reason that one of our indicators changed from red to yellow is because of that data change. And now we have really no lagging data. So I think this should be a huge asset to the community, that we can really see data right up to date and be able to analyze it even better. But like Director Christensen said, we are right on the verge of red yellow. And I think it is important to remember, we're not in a bubble in Milwaukee County. We are affected by what goes on all around us. And so as we see states and counties throughout our state going in the wrong direction, there's no reason to think that Milwaukee County is going to be the one exception and start going in the right direction.
Excellent. And the last question I'm seeing in the queue is from Matt Smith with WISN 12. And perhaps Dr. Weston, you might be able to first comment on it. It's, with today's higher case numbers reported, can that be attributed to the National Guard sites being shut down over the weekend?
Would increased case numbers be attributed to the National Guard sites being shut down? So the National Guard sites saw, I think, an influx of patients. We saw higher numbers in the beginning of the week, probably because of pent-up demand over the weekend, and probably also because of people who maybe went out and were in more group settings over the weekend and had a higher level of concern and wanted to get tested. So I think there's a number of reasons why that may be. We do know with case rates, of course, that is affected by testing. Testing doesn't create more disease, but it certainly finds more cases, which is very important to isolate and prevent further transmission. But again, I think that percent positivity is really the number to focus on to get an understanding of what the trend is in our community. And we are seeing a steady, though slightly increasing percent positive. So it's a number we'll definitely want to keep an eye on.
Excellent. Those are all the questions I'm seeing in the queue. So I think that ends our briefing for today. Thank you all for joining us, and we'll see you next week.
Thank
Thanks,
you.
everyone.
Thank you.